A 42 years old lady present with a small lesion in the right lobe of the thyroid gland. Following excision, the histopathological assess the lesion remarks about the significant amount of dystrophic calcification and associated with the lesion. What is the most likely underlying definitive diagnosis? So we have to find out a diagnosis that a 42 years old lady present with a small mass in the right lobe of the thyroid gland. Here the options are the follicular adenoma, follicular carcinoma, anaplastic thyroid carcinoma, papillary carcinoma, and toxic nodule. So what may be the option? First of all, let's see the papillary carcinoma. The papillary carcinoma, it is the most common type of carcinoma and it accounts for the 60% of the total thyroid carcinoma. The second one, the accurately diagnosis with the FNAC, that means the fine needle aspiration cytology. So papillary carcinoma, it can be diagnosed by the fine needle aspiration cytology, but the diagnosis of the follicular carcinoma, it's not usually done by the FNAC. Histologically, they may demonstrate the Samama bodies and orphan ani nuclei. So this point is very, very specific for the papillary carcinoma. One is the Samama body. What is the Samama body? Samama body of the area of the calcification. So calcification occurs in case of the papillary carcinoma. That means it is the just concentrated, such as there. This is a layer of the calcium, another layer of the calcium, another layer of the calcium, another layer of the calcium. So the calcium, they are present in the layers, and this is known as the Samama body, and the Samama body is specific for the papillary carcinoma, and it is the area of the calcification, that is lamellar pattern or concentric pattern. So concentric pattern of the calcification in the thyroid gland, it is the Samama body, and it is the diagnostic feature for the papillary carcinoma, because in case of the follicular carcinoma, there is no Samama body, there is no calcification, and also there is the orphan ani nuclei. That means in case of the cell, what occurs, the whole of the cells usually empty and the nuclei present at this site, and it looks like orphan ani. So it is known as the orphan ani nuclei. So Samama body, orphan ani nuclei, they are the diagnostic feature for the papillary carcinoma. In histology, they usually metastasize by the lymph node and lymphatic. So it is mnemonics is the LP, which is the lumbar puncture or PL. So lumbar puncture or PL, L for the lymphatics, P for papillary carcinoma. So it is the LP or PL. LP, which is the lumbar puncture, or PL, which is the prolapse disc. So we can remember, or we can remember any of the mnemonic to remember the lymph node metastasis here of the papillary carcinoma. Here we can see PL or LP. PL, that means the papillary lymphatic or lymphatic papillary. Usually metastasis from the well differentiated papillary carcinoma. So what is it? This one point, which is the dystrophic calcification, it is go for the papillary carcinoma. On the other hand, the follicular carcinoma, it usually metastasizes by the blood, and in case of the anaplastic carcinoma, it present with severe form. So our answer is the papillary carcinoma, because here the dystrophic calcification present, which is known as the Samama body in case of the papillary carcinoma.